All right, everybody, welcome. I think we're going to get started. So I'm Lauren Tobias, and I'm going to be moderating today's Yale Sleep Seminar. I have a few quick announcements before I introduce our speaker. To receive CME credit for attendance, please see the chat room for instructions, and you can text the ID for this conference anytime until 3:15 p.m. Eastern. I encourage you to make use of the chat room throughout the hour for questions, and we'll also have some time at the end for folks to unmute themselves and ask questions aloud. If you can please make sure you are muted for now, I'd appreciate it. And finally, please feel free to share our announcements for this lecture series to anyone else who you think may be interested. You can reach out to Debbie Lovejoy to be added to our email list. So now, without further ado, it's my delight to introduce Dr. Cassandra Mullen, who is our first of our Yale Sleep Fellows giving their sleep seminar talks for this spring. Dr. Mullen received her undergraduate degree in mathematics and statistics from Carleton College in Minnesota and her medical degree from Georgetown University School of Medicine. She completed her internal medicine residency at Oregon Health and Science University, where she participated in the Global Health Scholars Program and was the recipient of a Clinical Excellence in Education Award in recognition for being a dedicated and exceptional educator, and twice the recipient of a Clinical Excellence Award, which is given to the top 10% of providers in recognition of outstanding patient care. It's no surprise that she was selected to be a chief resident there, and following residency, she spent a year as a medical officer in New Zealand before coming to Yale for her sleep fellowship. She's doing a research project this year, mentored by Dr. Clara Yagi, that examines the relationship between sleep duration and circadian misalignment as related to athletic performance. As part of this, she's leveraging a naturally occurring experiment, so the shift from into daylight saving time, and looking at its impact on NBA performance, specifically free throw percentage. So we look forward to the results of that exciting work. I want to just say that on an interpersonal level, it's really been a delight to work with Dr. Mullen this year in our fellowship program. She is highly motivated to work, to learn, dedicated to teaching, has exhibited excellent communication skills with patients and families. And really early in her fellowship, she approached me feeling inspired to learn more about the intersection of sleep medicine and athletic performance, which spurred on her research project. And I recently learned that she also has some athletic accomplishments herself. She was a highest scoring high school basketball player west of the Cascade Mountains for 3 years, men and women as the denominator there. She had the highest free throw percentage herself in her senior year of college basketball, and also is a pretty excellent tennis player. So we look forward to hearing a little bit more about this afternoon. Dr. Mullen hopes to return to the West Coast to work in an outpatient sleep setting next year. So without further ado, please join me in welcoming her this afternoon for her talk entitled "A Free Legal Performance Enhancer: How Sleep Duration Powers Athletic Performance." I'll hand it over to you, Cassie.
Thank you so much, Dr. Tobias, for that really nice and mildly embarrassing introduction. And thank you everyone else who has come to listen to my talk. I'm really excited to be here to present to you on this topic. As a former, more competitive athlete and perpetual competitive person, this topic is of interest to me. And so I'm really excited to share what I've learned with you all today. So let's get started. Here's your classic CME credit slide. You can text this code to this number for CME credit. Oh my goodness. And I believe that's the fire alarm in my apartment. Can you guys can all hear that? Yeah, Erin.
We can. I'm less concerned about that than your safety, Cassie, though. If you need to get out and do this, get a jacket and do it outside, that's fine. Do what you need to do.
Hold on for a couple minutes and I will log back on 2 minutes later in a quiet location.
Totally fine. I don't remember the SNL person, but talk amongst yourselves. That's what I'll say.
It's coffee talk.
Who is it? Coffee talk. That's what it is. All right. Why is a chickpea neither a chick nor a pea? Discuss. For folks who are just signing on, just to orient people, our speaker, Cassandra Mullen, has had a fire alarm go off in her apartment. So she is trying to get herself to safety and to a place where she can be audible without a fire alarm in the background. So we're giving her a couple minutes here. Thanks for your patience, everyone.
Hello, I'm back. Can you hear me, Lauren, or whoever?
We can hear you and we can see the presentation.
Sure. My apartment building has two buildings, so we've jogged over, got our heart rate up a little bit to the other building. Thank you guys for bearing with me. I'm optimistic my apartment building is not burning down. Anyway, thanks all for coming. Let's get started. I was going to start off by telling you about a few cases to help frame our thinking about sleep and athletic performance. So you probably have heard of LeBron James. He's the all-time leading scorer in the NBA and a 3 or 4 times NBA MVP. Simone Biles is the most decorated Olympic woman gymnast, actually take out woman, American gymnast in history, with many 11 medals and also a lot of world championship medals. Roger Federer was the #1 tennis player for 310 weeks, which is a pretty phenomenal streak. Also holds the record for the number of Grand Slam singles titles. Tom Brady is the player who has won the Super Bowl the most times, 7 times. He's won more than any other individual and any other franchise in history, which is pretty impressive. Katie Ledecky is the most decorated American woman athlete with 13 Olympic medals, I believe. Usain Bolt is another decorated Olympian, and even over a decade later, he still holds the record for the 100 and 200 meter dash. So what do these incredible athletes all have in common? They're all legends, great among their time. They all sleep a lot. They sleep way more than you do. Federer, James, and Ledecky all claim or have reported sleeping up to 12 hours in 24, which is pretty impressive. And every one of them credits sleep with their athletic performance. Sleep as a key component to their athletic performance. But just because all the cool athletes are doing it doesn't actually mean it's useful. Sleeping might be the equivalent of not washing your lucky pair of socks. And that's what I want to explore in today's talk. So we'll start with a brief background on sleep and athletic performance, and then define each of our components of athletic performance. And then we'll talk about sleep duration's impact on each of these components. And finally end with a note on napping. Most of you are probably familiar with a graphic like this that shows sleep needs throughout the lifetime. Most of our athletes are teenagers, young adults, some get enough sleep. And as it turns out, athletes are no different. This is a survey of 175 athletes. 30 of them are women, and they asked them how much sleep they felt like they need to feel well rested. And in general, people thought they need a little over 8 hours of sleep to feel well rested. And then they asked them how much sleep they got subjectively, and they had them wear actigraphy for 12 days to measure their sleep. And in general, people are not getting as much sleep as they think they need. In fact, in this survey, only 3% of athletes were meeting their self-assessed sleep needs. And 71% of athletes fell short of their needs by an hour or more. There's a lot of components of sleep that could be important for athletes. I'm focusing mainly on sleep duration here, but we could also talk about sleep quality, sleep efficiency, stages, circadian rhythm. And all of these are intertwined. For instance, if you have a circadian misalignment, it will probably affect your sleep duration, which might affect your sleep stages. So it's a little hard to disentangle, but I'm mainly going to focus on sleep duration here. Athletes have a lot of barriers to sleep. Many of them travel and suffer jet lag. They could have anxiety about performance. They might have late night competitions or early morning training sessions. Many use caffeines or stimulants to try to enhance performance. Some have to watch film in the evenings to try to learn about their own performance. They have physical pain, both from injuries and from training and soreness. They often sleep in unfamiliar sleep environments. They have media obligations, and some have social media obligations, particularly women athletes who tend to be less well paid and make up that income with social media obligations. And then finally, athletes can have sleep disorders just like everyone else. So I want to define the components of athletic performance. There's 4 components of athletic performance to help us frame the research we look at. The first component is physical ability. Physical ability is how fast you are, how strong you are, how powerful you are. It's how high you can jump, how fast you can sprint. And when I'm talking about physical ability, you can keep an eye out for my little bicep icon on the slide. The next component is skill. Skill is The technique specific to the sport, that's important. It's not how far you could throw the ball, but can you throw the ball with the perfect timing and the perfect distance to your teammate who's running so that they can catch it in stride? Or not how high you can jump, but can you make the shot at the apex of your jump as you're hovering in air? The next is cognitive ability, which I think is the broadest of the categories. It includes things like reaction time, focus, attention, inhibition of distractions. And I include mental health in this category also, which can be really important for motivation to train and for competition outcome. And then my final component is injury prevention, because there's nothing that can cut an athlete's progression short like an injury, nothing that stops people faster than an injury. So let's start by talking about physical ability and its relationship with sleep. The first study that I want to tell you about is a randomized crossover experiment. So each participant participated in each arm of the study with a 6-week washout period in between. And they included 12 healthy men, average age of 30, normal BMIs, and this group did not exercise at baseline or exercise fewer than 4 hours a week at baseline. And they told these groups to either sleep as normal or spend at least 10 hours of sleep in bed. Before this period, the researchers used actigraphy to make sure nobody was starting at a sleep debt. And then they had them undergo 6 nights of either normal sleep or sleep extension. They measured again using home PSG equipment how much sleep they were getting when they told them to spend longer in bed. And on their normal sleep nights, people were getting about 7 hours of sleep, and the sleep extension, the participants were getting about 8 hours of sleep, a little over 8 hours of sleep. And they had them do the very fun exercise of isometric knee extension. So how long you can hold your knee straight for. After the 6 nights of sleep extension, people could hold their knees straight for about 4% longer than they could after the 6 nights of normal sleep. They also tested their maximal strength, and there was no difference in the maximum amount of quad strength that these participants could generate. The researchers went one step further, and they slept deprived these folks for 1 night after the 6 nights of normal sleep or 6 nights of sleep extension. And then they measured again. Day 0 is after the 6 nights of sleep extension or 6 nights of regular sleep, and day 1 is after 1 night of sleep restriction, where they described gently prodding them awake every time they fell asleep. And my carrot is going the wrong way here, actually. In the habitual sleep group, the regular sleep group, they saw a greater decrease in the duration of time they could hold their legs straight compared to the sleep extension group. They saw a less severe decline in their muscular endurance. The difference was about 8%. So if you remember one thing from this study, I hope you remember that sleep extension improves muscular endurance and had a protective effect after 1 night of sleep deprivation. The next experiment I want to tell you about was an experiment in cyclists. There was 9 male cyclists included in this. They had to be in competition for over a year and have a VO2 max over 55. If VO2 max doesn't mean anything to you, a VO2 max of 40 is the minimum that you have to be a firefighter. So you're fit enough to be a firefighter over 40. So 55 is a pretty impressive VO2 max. And another crossover experiment, they had people either sleep their normal amount for 3 nights, sleep restrict for 3 nights, which they did by decreasing the time in bed by 30%, or sleep extend for 3 nights. And again, they increased the time in bed by 30%. Different than the last study, where they had all the participants wake up at 7 a.m. In this study, they tried to maximize time asleep by basing their recommendations on the individual's chronotype. So early birds were instructed to go to bed earlier to try to get more sleep, and night owls went to bed later to try to get their more sleep, to try to maximize time asleep rather than just time lying in bed. And you can see the sleep restriction group got a little under 5 hours a night. The normal sleep got a little under 7 hours a night. And the sleep extension group got almost 8.5 hours a night. On each day of the experiment, they had them participate in a time trial, cycling time trial. The red lines, which are always the lines on the left in this graph, is the sleep restriction group. The middle black line is the normal sleep group, and the green lines are the sleep extension group on the right. Day 1 is before any sleep intervention. Day 2 is after 1 night of either sleep restriction or sleep extension, etc. It's not till day 3, so after 2 nights of either sleep restriction or sleep extension, that we start to see a statistical difference. The sleep restriction group is statistically slower than the regular sleep group by about 3%, which is about 2 minutes in this test. And that is exacerbated on day 4 after 3 nights of sleep restriction, normal sleep, or sleep extension. These folks, again, worsened by another minute and a half. And this time, our sleep extension group is also significantly different. Their time has improved by about 2 minutes. I was looking for a cycling race that was about this time to see what the difference in 2 minutes is. And in the most recent Olympics, the 2024 Olympics, the women's 34-kilometer race was a little under an hour. And the difference, a 2-minute difference was the difference between a gold medal and off the podium, 5th place. So 2 minutes is a big difference in this group of people. So if you remember anything, I want you to remember that several nights of sleep extension improved cycling times, while sleep restriction worsened cycling times. Most of what I'm going to talk about is sleep extension in this talk, but we actually have more research on sleep restriction, so I feel like I'd be remiss if I didn't talk at all about sleep restriction. I made this beautiful table to summarize some of the studies that have been done. I'll just note that there's a lot of variabilities in the study because you measure different metrics of athletic performance, different metrics of strength and speed for different times. And then you can also sleep restrict in many different ways, either at the beginning of the night or at the end of the night, or totally sleep deprived where you don't let them sleep at all. And for different amounts of time. So there's some variability in our results. But I did my best to summarize. In general, maximum strength is not really changed by sleep restriction for either 1 night or multiple nights, or total sleep deprivation. There's some evidence that chronic sleep restriction for more than 1 night, we start to maybe see some decrease in maximal strength. There's not very many studies looking at submaximal strength, but it does seem like chronic sleep restriction decreases submaximal strength, and sleep deprivation doesn't seem to have an impact, but again, only 1 study there. Aerobic performance and like jumping height. We generally see that these are negatively impacted by sleep restriction and sleep deprivation, especially aerobic activities that last greater than half an hour. Interestingly, the studies that looked at trained athletes and acute sleep restriction found that trained athletes saw a decrease in aerobic performance and jump height. Whereas untrained athletes, we didn't see any difference after 1 night of sleep restriction, which I think is kind of interesting. I want to tell you a story about Andre Iguodala. He is a now retired NBA player, and in the first part of his career, I feel like he was having a good career by any standpoint, anyone's standpoint. He was the 9th draft pick. He was on the Olympic team. He was an all-star. He played in multiple playoffs. In 2015, when he was 28, which is the average age of retirement in the NBA, he decided he wanted to focus on sleep. Or he decided he wanted to try to extend his career, and in so doing, focused on sleep and hired a sleep consultant. He did that in the off season, and the next season, his points per minute increased by about a third, and his free throw percentage and three-point percentage also increased by 9%. And he had a long, illustrious career after that. He was an NBA champion 3 times over with multiple other appearances. He was the NBA Finals MVP for his phenomenal defense on LeBron James. He won an Olympic gold medal. He was on the all-defensive team. So he had a pretty fantastic career after focusing on sleep. He finally did retire after 19 seasons in the NBA, which is a pretty incredibly long career for an NBA player. I want to transition to talking about sleep and skill, and there's a couple of experiments I want to tell you about. The first one is an experiment looking at tennis serving accuracy in college tennis players in Walla Walla, Washington. They looked at 12 tennis players, both men and women, the first time we have women in our experiment, and they had them undergo normal sleep for a week and report how much they slept. These are subjective reportings of sleep. These folks thought they were sleeping a little over 7 hours a week, and then they measured their tennis serving accuracy. And then they underwent 1 week of sleep extension, where they instructed participants to try to get 9 hours of sleep. And if you couldn't get that much at night, they were told to, or asked to try to make up for it by napping during the day. And those folks reported that they got just shy of 9 hours. And then they measured their tennis serving accuracy again. After the week of normal sleep, their serving accuracy was 36%, and it went up by about 6.1% after the 1 week of sleep extension. This is obviously a very small study. It also doesn't include a control group, so it's impossible to say if this improvement is just because of sleep or if something else might be a confounding factor here. But the take-home point is that serving accuracy improved after 1 week of sleep extension. The next study I want to tell you about is also in college players, this time basketball players at Stanford. They monitored their sleep using actigraphy in this study and had them keep sleep diaries. They started with a 2 to 4 week run-in period of normal sleeps. And these 11 male basketball players had about 6.6 hours of sleep a night during their normal sleep period. And it was followed by 5 to 7 weeks of sleep extension, where the goal was to spend 10 hours in bed. And if they couldn't get that 10 hours in bed because of travel or whatever, they were instructed to try to take naps to make up the time. And they, by actigraphy, had 8.5 hours of sleep. And then after every practice, they measured specific indices related to basketball to track how they changed during this 5 to 7 weeks of sleep extension. They found that shooting accuracy improved in the sleep extension time. By the end, both free throws and three-point percentage improved by 9%. You can see the baseline and the after here. Beautifully, that 9% is the same percentage increase that Andre Iguodala saw in the NBA, coincidentally, or maybe that's the magic percent. They also measured sprint times, which is probably more of a physical metric than a skill-based metric, but they saw improvements in their sprint speed as well. I think this graph is really beautiful because you can start seeing the improvement, the faster sprint time, hence the negative deflection of the graph pretty quickly, and it just extends the longer the sleep extension period was going on for. And then finally, they asked these players to do self-assessments after practices and games to ask them how well they thought they were playing. And their self-ratings also increased during this time. So I will say, I guess, before the take-home point, that this experiment has the same flaw as the last experiment, that it's small, it's happening during the season, and doesn't have a control group. So I don't know how much basketball players improve during the season at baseline to compare it to know how much of this is purely related to the sleep intervention. So the take-home point is weeks of sleep extension improved shooting accuracy, sprinting speeds, and subjective self-ratings. As I transition to talking about the cognitive benefits, I wanted to highlight Simone Biles. Most of you are probably aware that Simone Biles withdrew from many events at the 2020 Olympics in Tokyo because she was experiencing the twisties, which is a dangerous mental block that gymnasts can experience where they can't tell where they are in space. And this is due to stress and anxiety. She's become a big advocate for mental health in athletes, which I, for one, am appreciative of. And I was really excited when she came back in the 2024 Olympics and absolutely crushed it. So we'll start by talking about mental health in athletes. Anxiety is really prevalent in adult athletes from 7 to 26%. Student athletes report even higher rates of anxiety, up to 37%. 21% of athletes report anxiety as the primary reason for nighttime awakenings. And they also report that sleep is worse the night before a competition. Alcohol misuse in adult athletes is estimated at 19%. And depression is also really prevalent at 16 to 34%. So we know it's prevalent, and we know that there's a bidirectional relationship between sleep and mental health, but how does athletic performance come into play there? I want to tell you about this survey of almost 600 Brazilian elite athletes, about a third of whom were women. 60 minutes before a competition, they surveyed them, and they asked them the Brunel mood scale, which asks questions about anger, mood, depression, vigor, tension. And then they asked them one simple sleep question, which is, how would you evaluate the quality of your sleep in the last few days? And then they correlated those responses with the outcomes of the competition. And they found that tension, sleep, anger, tension, and vigor predicted an athlete's performance in the way you might expect. So poor sleep was associated with worse performance. Higher anger, lower tension, and lower vigor were also associated with worse performance. And also, not surprisingly, there was an association with subjective poor sleep and mood states. So worse sleep was associated with higher anger, higher tension, decreased vigor, more confusion in the way you would expect. So sleep, mental health, and performance are all correlated. Next, I want to talk a little bit about sleep and memory. We know that the non-REM sleep is really important for declarative memory, remembering facts and events, whereas the REM sleep is really important for procedural memory, remembering the newly acquired skills like riding a bike is a classic example. So we could say that procedural memory is really important for our athletes who are trying to retain all that physical information they learned from the practice or game. And we know that the longer you're asleep, the more REM sleep you get, or the more REM predominant it gets. We get more of our REM sleep later in the evening. So we can extrapolate a little bit that if we're cutting off our sleep prematurely, we're probably cutting off REM sleep, which is important for these procedural memories. There was one study I wanted to tell you about, which is not in athletes, is actually in patients with severe COPD, or not COPD, OSA, obstructive sleep apnea, and they had to be compliant on CPAP to be included. There were 21 participants, and they had them train on a virtual 3D maze that was designed for this experiment at 8 p.m. in the evening. And they were told to make it as far as you can, try to remember the layout. And then they had them sleep in the sleep lab, and they either slept with their normal CPAP or they had REM disrupted sleep. In the REM disrupted sleep, anytime the PSG tech noticed that they went into REM sleep, they would turn down the CPAP to 4 centimeters of water of pressure, effectively turning off their CPAP. And then they would return it to a therapeutic pressure after the REM sleep stopped. And in the morning, they did psychomotor vigilance testing to see if reaction times were different, if that could explain any differences. And actually, psychomotor vigilance testing was not statistically different between the two groups. Between the two groups, the REM sleep group got less REM sleep, excuse me, about 11% compared to 20% in the normal sleep group. But sleep efficiency was largely the same, and sleep duration was also largely the same. And they asked them to do the maze again in the morning and looked at how much better they did. The folks who got the normal sleep in the light boxes here, they improved their completion percentage. The percent who completed the task improved by about 35%. Whereas in the REM disrupted group, it actually worsened by about 5%. The normal sleep group also traveled further, whereas the REM disrupted group on average actually traveled about the same, a tiny bit worse. And the normal sleep group spent much less time backtracking than the REM disrupted group. So the REM disrupted sleep folks really did worse at remembering the maze that they were trying to learn. So my take-home point from this section is REM sleep is important for procedural memory formation, which is key for athletes. There's a lot of different cognitive components of cognitive ability, and they're not all equally important for each sport. One way to divide it up is to think of sports that rely on external pacing, which tends to be team sports that have multiple people running around that you have to react to. Those sports, you need high problem-solving skills. And then there's the other half of the sports is sports that rely on self-pacing, internal pacing, which can be sports like golfing or bowling, where you kind of go at your own speed, or when you're serving or pitching. And long distance running, and those folks need to be able to suppress distractions like fatigue, exhaustion, and crowd noise. Both groups need decision-making capacity and decision-making speed, though. I only have 2 studies that looked at the impacts of sleep extension on cognition in athletes, and we've actually talked about both of them already. If you remember the Stanford basketball study, which looked at 5 to 7 weeks of sleep extension by about 111 minutes a night, or the Whitman tennis studies, where they had 1 week of sleep extension by about 100 minutes a night. We found that in the Stanford basketball study, we saw improvements in the psychomotor vigilance testing, a reduction in sleepiness and fatigue, an increase in vigor and well-being. And in the tennis study, we saw improvements in serving accuracy, which you probably are like, hey, Cassie, you just told me that that is a skill. Why are you calling it a cognitive benefit? And I'd like to addend that serving does involve focus and attention. So I include it here as kind of a composite outcome that both involves skill, but also involves some components of cognition. There are a few studies looking at sleep restriction in athletes that are nicely summarized in this table. There was an experiment on offshore solo sailing, which can be an event that inherently necessitates sleep restriction. If you're out by yourself for over a day, you're probably not sleeping very much. And they saw that there were an increase in lapses in simple reaction time with sleep restriction. In darts players, they saw a decrease in precision and accuracy. In tennis players, there's a decrease in serving accuracy. And this decrease in serving accuracy wasn't corrected with caffeine use. In rugby players, there's a decrease in passing accuracy. And in weightlifters, after a few nights of sleep restriction, they saw more sleepiness, more confusion, more perceived effort, and decrease in vigor. I want to tell you one more story about an athlete. This is Ryan Jensen. He was a standout player at Colorado State Pueblo and was drafted by the Ravens in, I want to say, 2013. His first season, he really flopped, though. He couldn't keep up. He felt like he was getting less fit rather than more fit. He was losing weight, the good type of weight, the muscle weight. And he ended up on the practice squad. It's possible that his career would have just ended right there. And he really credits his wife with his career comeback because she encouraged him to get tested for sleep apnea. Turns out he has sleep apnea, and when he started treatment with CPAP, he felt so much better. He had more energy, he gained muscles again, and his on-field performance really soared. A few years later, he was back on the Ravens, and the following year, he signed a 4-year, $42 million contract to become the highest paid center of, or whatever his position is, I think it is center of all time in the NFL. I'm not talking too much about sleep apnea in this talk, but I will just comment that it's estimated that about 1 in 7 NFL players have sleep apnea. So let's talk about sleep and injury prevention. The studies I have to tell you about are all surveys. The first is a survey of adolescent athletes. It's a retrospective survey looking back. 112 athletes participated, where they had about a 70% completion rate, ages 12 to 18. And then they looked back at their athletic department's injury records from the preceding 21 months and correlated the responses on the survey to the athletic department's records. And they found that those who reported that they slept more had fewer injuries. If you slept fewer than 8 hours a night, you were at about a 1.7 times increased risk of injury compared to if you slept greater than 8 hours. They have this beautiful graphic which shows the correlation between, or the likelihood of injury over the preceding 21 months against self-reported sleep data. Again, this is a retrospective study looking back and relies on self-reporting. I also don't know how accurate my middle school or high school's athletic department injury records were, which might be another downside, but hopefully they were more accurate than my high school. The next survey I want to tell you about is a survey of college athletes, D1 athletes, soccer and basketball players. There was 181 athletes, and they had them fill out the athlete sleep screening questionnaire. And then again, they looked back at the preceding 12 months of data on knee and ankle injuries. And they found that in this study, sleep duration did not have a statistically significant greater risk of injuries, but poor sleep quality did. If you said you had poor sleep quality, you were at about a 2.2 times increased risk of having had an injury in the preceding 12 months. This study has similar downsides to the last one, although probably college athletic departments keep more accurate results. And the last study I wanted to tell you about is another study of NCAA athletes. This one is 190 athletes who participated before the school year started, preseason. And they gave them the Insomnia Severity Index, the Pittsburgh Sleep Quality Index, and the Fatigue Severity Scale, some standardized surveys in the sleep world. And then these guys waited a full year and then looked back at medical records to see if there had been any injuries, specifically looking at concussions. And they did find a higher risk of concussions in people who were sleepier. Those who reported moderate to severe insomnia had a 1.3 times risk of concussion. And those who reported excessive daytime sleepiness 2 or more days a month also had about a 3 times increased risk of concussion. Interestingly, the concussion risk was more strongly associated with these sleep metrics than the sport they were playing, if they were playing in a high-risk sport like football or soccer. And it was more strongly correlated even than if an athlete had had a previous concussion. So less sleep and worse sleep was associated with higher rates of injuries is the take-home message that I want you guys to remember. We're left to speculate and hypothesize a little bit about how good sleep can lead to injury prevention. I don't think anyone knows if it's something at the cellular level, if there's some cellular healing that's happening in the muscles and tendons, or if it has more to do with reaction time, where if you place your foot slightly wrong and you can react and not put your whole weight on it, you might be less likely to twist your ankle, or if you dodge that glancing blow and miss the concussion just a little bit. We just don't know at this point. My final note is on napping. And the bottom line is napping is good for athletes. Each of these arrows represents a study that looked at napping in athletes. And it's beautifully, simply summarized by an improvement, no change, or a worsening. And you can see in general, napping improved physical performance, cognitive performance, fatigue and muscle soreness, and sleepiness. And the results for alertness, psychological state, and nighttime sleep are either positive or equivocal, a little bit more mixed there. There was only one study that looked at napping after 4 p.m., which is not generally when we nap. And the result they reported is that it worsened nighttime sleep. So napping is good. Nap away for the athletes. These positive results were more strongly seen in folks who were sleep deprived at baseline, but they were still seen in folks who had a normal amount of sleep. So overall, longer sleep can increase the time to exhaustion, improve your speed, improve sport-specific skills like shooting percentage in basketball and tennis serving accuracy, improve reaction time, reduce sleepiness and fatigue, improve well-being, and it may prevent injuries, including concussions. So overall, longer sleep leads to better athletes. I just wanted to end by once again thanking you all for coming, and I wanted to especially thank Dr. Tobias and Dr. Krieger for helping me with this presentation and putting it all together. And then I wanted to thank Dr. Yagi also, my research mentor. And I would love any questions.
Thank you so much, Dr. Mullen, for a fantastic presentation. We have some questions in the chat, and I'll read some of those. So Dr. Yagi says, excellent presentation, Cassie. Regarding the data on aerobic performance, were those studies done using cardiopulmonary exercise testing or CPET or other metrics of aerobic performance, if you recall? And if CPET was used, was VO2 max the primary endpoint? Was one question.
Yeah, that's a good question, Dr. Yagi. They were not using CPET in most of the studies. We're just looking at how far you could go in a certain amount of time, not using CPET, basically.
Great. Thank you. And then there's a question from Brandon Goldner asking about how the data about sleep quality should inform best practices on how college programs schedule mandatory attendance events like practices, film sessions, etc. For example, that is leaving enough time after practice for athletes to actually wind down, perform a bedtime routine, then get enough sleep before school or sports obligations the following day. So sort of the how do we balance the priority of sleep and then all of the activities related to the sport itself?
Yeah, that's an excellent question, and or it definitely, sleep is something to be prioritized if you're trying to maximize athletic performance. So I would recommend intercollegiate teams think twice, particularly sports like swimming, which are notorious for having early morning practices. There's actually at least one study where they had uh, participants not come to half of the practices a week so they could sleep longer. And they actually did not see any worsening in their times, even though they were practicing less than their fellow colleagues. I would recommend to, sports, particularly like swimming and other sports that are known to have early morning practice times, to consider the timing and consider the timing after games, if watching film after a game is also important, or if that could be done the next day. And I think your point about winding down is also a good point. Having a good wind down routine is great for anyone who's trying to sleep. And it can be an effective tool for athletes who might have a late night game and are trying to go to bed. If you are in the habit of having your nighttime ritual where you take a shower and read a book and go to bed, if you can maintain that even on days when your schedule is a little bit shifted, that can help you get to bed sooner rather than have compounded impacts from those effects.
Great, thank you. We have several more questions. We'll see what we have time for here. So Dr. Karin Johnson at Bay State, hi Karin, asks, do we know anything about the use of sleep aids in athletics? If someone is a short sleeper or has insomnia, would giving a sleep aid be considered to see if it improves athletic performance?
That's a really good question. I saw no studies looking at sleep aids in athletic performance. Anecdotally, I will say that there are some athletes, like Serena Williams, for example, who's notorious for having insomnia and being a self-described short sleeper. And she has really had to focus on trying to get enough sleep and some techniques to get even 6 hours of sleep. She has, or like one of her Grand Slams, supposedly the finals was played after 2 hours of sleep. So she seems to be doing okay for herself, but that would be really interesting to see if sleep aids enhance athletic performance, but I don't think it's been looked at.
Thank you. Another one of our fellows, Jen Langstangle, is asking about sex differences between male and female athletes, both in terms of their sleep need, but also differences in sleep patterns. Any thoughts about that?
Yeah, thanks, Jen. That's another really interesting question that we have a scarcity of data on. Most of our studies on sleep and athletics are predominantly looking at men, and the ones that included women didn't find a difference. The only studies that found a difference were looking at the prevalence of depression in student athletes. Or they were higher in women than men. I think it would be a really fascinating research topic, though.
Great. And then a question from Stuart Hoffman. So he's saying, thank you for this excellent presentation. Are there any studies looking at N3 sleep and strength performance, perhaps mediated by GH? I think that's growth hormone. Might weightlifters improve with evening sleep extension?
I didn't see any studies looking at N3 sleep and athletic performance, but that is a really interesting question. I don't know the answer.
Thank you. And then just going back up again, Dr. Yagi had asked about whether you knew anything about the prevalence of insomnia in the NCAA survey that you had mentioned. I guess I can just broaden that to, anything that you want to say, although insomnia wasn't the focus of your talk, but just about insomnia and athletes.
I believe the prevalence of insomnia in that survey was around 36%, so pretty high. And it was correlated, or athletes reported more insomnias on nights before and after competitions also in that survey.
Great. Thank you so much. I think this was super informative for all of us, even if we're not competitive athletes like those whose photos you showed at the beginning and who you highlighted, although they remain an inspiration to us all. But even for those of us who fall in the don't exercise category, which I like, as to how it was not lost on me that that was defined as less than 4 hours a week. I felt mildly offended.
I apologize.
I'll consider it exercise if we do less than 4 hours a week.
I'll add, don't exercise much.
There you go. Not enough. But I think we can all find some take-home points for ourselves and our patients in this. And I love any talk that focuses not just on sleep pathology, but how we can use sleep health to improve performance for the better, even in people without a diagnosed sleep disorder. So thank you so much, Cassie, for this wonderful talk. And I don't have the schedule in front of me to see what we have going on next week, but we'll see you all then. Take care.
Thank you so much. Thanks everyone for coming.
Thanks. Bye.